Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you today with the Common Sense MD. We're going to talk about hair loss, really mostly in men. The reason I brought this up was because I was in church the other day in the back. I always sit in the back. I try to sit in the back, make for a quick exit or whatever. Just kidding. But in any event, I was looking at the backs of people's heads, and way more than half of the men had a big bald spot in the back of their head. And I'm just thinking, how does that happen? I don't want it to happen. There's certain things that you can do to prevent that from happening. Once you're bald, besides a hair transplant, you're not going to reverse it. But there's a lot of misunderstanding about hair loss in men. I'll briefly mention women because really it's more devastating to them. But in any event, when you're in the back of an auditorium, check the backs of men's heads. And over half those, if they're adults, are going to be bald or have a big bald spot. Most people think that it's just hereditary, and that certainly plays a big part. But it's also hormonal, and that's why I'm delving into this, because I treat hormones. And it can result from a lot of medical conditions, like fungal scalp infections, hypothyroidism, vitamin deficiencies, thyroid problems, even stress. Half of what brings a patient into my office, if you look at the root cause of it, and this is real stuff, is caused by stress. So poor diets, it's something we constantly will talk about, is nutrition and poor diets. That can certainly contribute, especially lack of protein and iron. The key to preventing and treating hair loss is really early treatment. If you have a lot of bald spots, it's not going to work so well. And it's very expensive to get a hair transplant. But they do work. They can work. Many men don't mind going bald, and that's fine. But if you do the statistics, 62% of men say that hair loss significantly affects their self-esteem. And women experience hair loss too, with 25 to 50% of women having this by age 50. And to them, it's much more devastating, of course, but much easier to fix, in my opinion. If a woman comes with thinning hair, I can usually reverse that or really help it. With men by age 50, 50 to 85% of men have significantly thinning hair. So that's why I'm mostly focusing on men's health today and men's hair loss. Male pattern baldness presents usually as a receding hairline or thinning at the crown and temples. It's called androgenic alopecia, and it's really responsible for 95% of the hair loss in men. Compared to women, with women, it's more loss in the part of the hair where they part their hair and diffuse thinning across the top and the crown, with the frontal hairline mostly unaffected in them. So it's different for men and women. Of course, they have different hormones, different factors. But we always look for a reason for hair loss. Need to rule out the thyroid problems, protein deficiencies, too much dihydrotestosterone. Dihydrotestosterone is an estrogen hormone. It's the most potent form of testosterone, but it's responsible for two bad things: prostatic enlargement and hair loss. And we measure this all the time. I check a lot of dihydrotestosterone levels in men and women. The other thing you need to note is that baldness affecting the crown, those men you're seeing from the back of the auditorium with a bald spot in the back of their crown, is associated with an increased risk of coronary artery disease as well. You ever notice how many bodybuilders are bald? A lot of people say, hey, if your bodybuilder and trainer isn't bald, then you're not getting a good trainer. Look at them. Look at the gym. And most of the big, huge guys that are usually on a lot of steroids are bald. That's because they have too much testosterone. They're taking too many anabolic steroids, and a lot of them are converting to dihydrotestosterone, which again is the most important, potent form of testosterone. It's important, but if you get too much of it, you're going to have prostatic enlargement and hair loss almost every time. Other vitamin deficiencies that are really important in this, of course, vitamin D, which is a hormone, the most important vitamin/hormone known to man for many, many reasons. Look at what it did for COVID. With COVID, the people that really did bad with it were either morbidly obese or low vitamin D. For the most part, there are exceptions. We saw it all. So vitamin D, iron, biotin, which is vitamin B7, is important for hair growth. Vitamin A, although too much vitamin A could also cause hair loss. So you have to look at that. Selenium is another good one. That's one of the things in my multis. Supplements that will help, other supplements, B12, natural form of vitamin E, vitamin C, omega-3s, zinc, copper, inositol, horsetail, saw palmetto, and something that I put in our hair formula called Anagain. To me, that's the secret ingredient in our hair loss formula. It really is derived from pea sprouts. It's very effective. Not many people know about it, but it stimulates the hair follicles into growth phase. Hair has 3 phases. One's growth, one's dormant, and one's loss. So it stimulates the follicles into growth, and it also blocks DHT, dihydrotestosterone. And I looked at a study from the NIH, and it can increase hair growth by 78% in 3 months. So I think that may be one secret sauce in our hair vitamin. So look at that. Another one that's being studied that we use all the time as well for your immune system is quercetin. Very important for a lot of different things. Prescription medications play a big part in reversing and preventing hair loss. Of course, the two vital ones are finasteride, which blocks DHT, and you just really need to use 1 milligram of it. If you use the 5 milligram, you're going to, like you would for BPH, prostatic enlargement, you're going to get a lot of sexual side effects you don't want. So finasteride, women that are of fertility age cannot get around this stuff. It's teratogenic for them. But I do use it in a lot of older women. The other prescription medicine is minoxidil, otherwise known as Rogaine. I don't particularly like the foams and gels people put on their hair too much. It's messy. They just won't do it. And remember, when you quit using it, you go back to square one. So I prefer the oral form of minoxidil, Rogaine. And you talk to all the derm people, they prefer it as well. Actually, minoxidil it's a blood pressure medicine that increases blood flow to the hair follicles, prolonging that growth phase. Also, it upregulates something called VEGF, a term we use in integrated medicine all the time, which is vascular endothelial growth factor. It's good. And it also opens up the potassium channels in your cells, which increase vasodilation. I personally, use these things. I also use a dandruff shampoo, like 2% ketoconazole, very effective. I use it 2 to 3 times a week. Other things, red light therapy is very helpful. Scalp massage, some peptides, PRP, we do that in the office. Platelet-rich plasma injections into the scalp. Microneedling helps. So there's a lot of studies on Botox even helping it. And the last thing is hair transplants. Now, they do work, but they're expensive. They can be pretty painful. So the lesson here is male pattern baldness is very common. Find a cause if you can. It's not just hereditary. A lot of it's hormonal. And please treat it early. Recognize that you're getting thin. Listen to your barber and treat it early. It can be helped. I hope this helps you. Coming in the office, we can test you and treat you, but recognize this early and you don't have to go bald. I'll see you next week. I'm going to give you a little bonus. I'm going to show you a couple pictures, one of the back of my head, two, the back of head of one of my brothers who's a year older who hasn't been using all this stuff. Now, again, I've been using this stuff along with finasteride and minoxidil, some red light, some supplements that we use. But in any event, try this stuff, do the other stuff, and see what you think.